in a partially edentulous case is extremely important. And you must know it with all the diagrams. You know class 1 is bilateral edentulous space, class 2 is unilateral, class 3 is an edentulous space unilateral with anterior and posterior abutment teeth, class 4 is an anterior edentulous span crossing the midline, and there are class 5 and class 6 as well. So the mention of all the Kennedy's classification with appropriate diagrams is extremely important. We cannot forget Applegates rules. They are the 8 rules which are again very important. To quickly go through them, your classification must follow rather than precede extractions. If a third molar is missing and not to be replaced, it is not considered in the classification. Rule 3, if it is present and you want to use it, it is considered in the classification. If the second molar is missing and not to be considered, then you don't include it in the classification. Rule 5, the posterior most edentulous area always dictates the classification. Remember that. Then you have rule 6, which determines, so edentulous areas other than those are basically modification spaces. Rule 7, the extent of modification is not considered. And rule 8, there can never be any modification areas in class 4. Why so? Because we understand that rule number 5 is the posterior most edentulous area determines the classification. Hence, class 4 is independently a class 4. It cannot have a modification area. So all these rules have to be accompanied with your diagrams, and that is something that you must know with your Kennedy's classification.